Hi, it's Big Northern Bear with Frankie here. And I realize it's been a long time since I gave a short update. And I'll have to keep it short today because I'm pretty sick. I'm just getting over pneumonia. My chest is it's very hard for me to talk and clean sentences. There's so much crackling in my chest when I breathe. It's just very difficult and it wears me out very quickly. So even if I just get up and walk like 10 feet to the bathroom, I'm literally just worn out because my chest is just so bad. And this started right after the vocal cord surgery. So we're sort of wondering if I got it from the intubation because the type of bacteria that was in my chest a few weeks ago is usually one that travels in the hospital, not in the community. So anyway, so sorry if I close my eyes when I talk. It's just because I have a lot of exhaustion. Just trying to think. So gonna answer some questions I've been getting. Yes, I'm still alive. Obviously, I'm still alive. So I haven't been doing well. I've started this new drug, Avastin, because 6 months to a year after the brain radiation, you can get something called radiation necrosis, which is showing up on my MRIs. I didn't realize how big of a problem this could turn into. So the radiation necrosis is literally brain tissue just dying. And so I talked to my oncologist about it, and it said it seems like this is getting a little bigger every MRI. He said yes it is. So we agreed I would try this Avastin or Bombezi, which is a equivalent drug. It's a monoclonal antibody. It's not chemotherapy, so it doesn't have all the sickening side effects that I don't want anymore. And I've been doing quite well as far as side effects. But to be honest, I'm on 8 weeks now. It hasn't done a lot for me. So we don't really know if it's because of the pneumonia that I'm not seeing improvements in my well-being, or if it's because the Bombezi is just not helping. So the other night, we got our MRI, and in about 2 weeks I'll get the results, and we'll see how that turns out, and go from there. So I've managed to reduce the steroids a little bit, and I'm on a water pill now. My edema has been going down. Unfortunately, I've had to get a catheter because I just get up with the water pills. I can't. A lot of times I had to skip them because I don't have the energy to safely go to the bathroom, like to walk to the bathroom. This month alone, I've fallen 4 times, and 3 of those 4 times it took about over an hour to get me up off the floor because I can't assist. My whole left side is basically paralyzed at this point. I can't lift my leg or my hand. I can't make a fist with my left hand. So it's very hard to walk like this and not fall, and to be stable and not fall. So especially things like standing up out of a chair are quite difficult. So we've got occupational therapy and physio coming to the house to assess me and see what they can do. Fortunately, I've been getting lots of good support from the professional, let's say the professional organizations in the area. I'm actually surprised at how many there are and how willing they are to help. So, anyway, the last month I've basically been, I'm not going to say bedridden, because I sleep in this chair so I can stay in my office because I can't do stairs right now. And my office has a bathroom on the same level, so I just sleep in my lift chair, which makes it easy to get out of when I need to. And I find it quite comfortable. I sleep very well. I have my CPAP next to me. I sleep very well in this chair overnight. And I actually, when I go to respite, they have a similar chair that's not nearly as comfortable. I really miss this one when I'm there. I sleep so good. And I have to put my feet up on a big foam wedge at night to drain the edema. My feet were like at some point the size of footballs. Now they're a lot closer to smaller, to a normal size. So that's good. And I think continuing the water pills, there's edema in my chest that we'll get rid of. And I think that can only help. So right now I'm waiting for the results of my mucus analyst. And I have a CAT scan on my chest, April 2nd. We'll see the results of those two things. And then the respirologist will decide on a course of treatment for me. For the first round of pneumonia, I had to wear a portable IV for 2 weeks. So I walked around taking IV antibiotics with this portable thing for 2 weeks. It was quite a pain in the butt. But I gotta say that my wife Lisa's just been wonderful through all this. It's been so hard lately. And she's just really been there for me. And for like about a year now, she's had to get up 5 times a night to help me to the bathroom. So now with the catheter, it's great. We both sleep through the night. What a difference it's made when she gets up in the morning and she looks rested. I feel so happy. I just love her so much and she's given me everything. And I love you all for the prayers you send me and for taking an interest in my journey, wherever it leads. Now, I said I'm going to stop talking about the seizures, but they've been pretty much absent. That's been the one good thing. They're pretty much a thing of the past at this point. I might have one in a month, and it's under a minute long. And they don't bother me at all. I can actually have a conversation during a seizure. And I do. I'll say the Lord's Prayer during the seizure to get my mind off it, and it'll take me out of the seizure. So anyway, when I leave the house, I pretty much have to go in a wheelchair to be wheeled around. If we go to the hospital for tests, or even just a grocery store. And this is challenging because our vehicle's not very friendly for me to climb into with one leg that doesn't work, and to climb back out of it into the wheelchair. So I'm looking at buying a electric scooter. The government's going to pay 75% of it, so that I can at least go for a walk around the block with Lisa and the dog. And speaking of the dog, hey Frankie, come on up. Come on up, boy. Frankie has a job now. He's got a career. He's my official service animal. I went and got him registered. Because when I have a seizure, he barks and he calls attention. So we qualified him as a service dog and an emotional support dog. So when I have my electric scooter, I was thinking, what if I drive all the way down to the grocery store and they say you can't bring your dog in? Then I'll have this and he can come in with me. Because I really want him to ride around with me. And I know he'd love that. So good old Frankie's really helping me. Really helping me emotionally. If I didn't have Frankie and Lisa, I'd just honestly be praying to die. It's just been so hard lately. Haven't been able to help at work at all. It's pretty hard to do training videos when your voice sounds like this and you have this raspy thing in your chest. So anyway, that's my update. I'm sorry it's not a lot of good news. But if anyone wants to pitch in on the electric scooter, go ahead, please feel free. I'll be $1,000 out of pocket on that, but it's really going to be a life upgrade for me. So I'm not going to do a GoFundMe or anything like that. I mean, just whatever super chats people throw, or super chat comments. It all helps out. It all goes in the same pile. So, yeah. It's been so hard. So everyone, please say a prayer for me and for Lisa. We'd appreciate it. Okay, I have to stop here, everyone. Thank you for watching if you got this far. Thank you.